everybody, welcome back to the Teach Back Method, where I teach you guys something I'm learning about in grad school to help me understand it better. For today's video, we are going to be discussing the steps of a shoulder exam. Let's break it down. I believe in a previous video I did something similar where we went over the steps of some sort of a spinal exam. I believe it might have been the lumbar exam. So for the purpose of this video, it's just going to be a quick overview as a lot of these concepts are the same. Starting out, per usual, we do have our history and subjective findings. We always want to know what we are walking into. So whether this is a chart review or the patient interview, so remember our subjective exam is whatever our patient is reporting to us. What are their complaints? What was the mechanism of onset? Were they in some sort of an accident? What are their symptoms, etc. Next up, we're looking at observation and posture. Now keep in mind, this is more so a rough outline, so a lot of these things can kind of be intermixed. And what I mean by that, we might be observing their posture as soon as they're walking into the clinic prior to even meeting them. Maybe we're walking into a hospital room, we're seeing them in bed, etc. So we might already be observing them before we even introduce ourselves. Next up, we have our upper quarter screen and any relevant neurological tests. So remember, our upper quarter screen includes things like dermatome, myotome, deep tendon reflexes, etc. And then depending on what we're finding, it might be relevant to do a neurological test, whether that be a cranial nerve test, etc. I also want to include that in this category, we do want to do a cervical spine red flag screening. So what I mean by that, our shoulder and cervical spine can often be intermixed sometimes. So it's very important when we're expecting one or the other to do a quick screening of the opposite, just to make sure, in this case, that our C-spine is not actually the cause of our problems. So after our C-spine is ruled out, we're going to move on to range of motion and manual muscle testing, per usual, like we do every other time. Next up, we have joint mobility. So how are things moving on each other? We always want to compare bilaterally, so our affected and unaffected shoulder, is one of them moving more than the other? Are we seeing any hyper or hypomobility, etc.? Next up, we have muscle performance and flexibility. In this category, we also are going to be doing our muscle length testing. Next up is palpation, so whether that be feeling for the insertion or origin of a muscle, a bony prominence, etc. Next up, we have our special testing. So throughout all this, maybe we have some sort of a hypothesis in mind. Maybe we're expecting a rotator cuff injury or glenohumeral instability, etc. So we are going to be performing the relevant special tests to help rule in or out our hypothesis in our head. And last up, we have our functional assessment. I hope this video helped you guys to learn more regarding the shoulder examination. Come back to my page to learn more.